The next presenter is Evan Ehrenberg from, and forgive me for wrecking your company's name, XPerii? XPerii. Thank you so much.
Hey everyone, thank you very much for sticking around for our presentation. I'm Evan Ehrenberg from XPerii, and today I'm going to talk to you about researchers conducting research in behavioral and clinical research and the individuals who are looking to participate in those studies, and what XPerii is doing to solve their problems. So in 2011, the NIH ran a national study and found that many members of the general population were unfamiliar with clinical trials and were unaware of opportunities for healthy participants to participate in them. Looking at people who are sick, we find that 85% of cancer patients were unaware of clinical trials for their condition, but 75% said that they would have participated if they'd known about it. Now, this is coupled with a scientific community where 34% of research studies fail to even recruit 75% of their target pool. And this is really, really bad in clinical trials, where 86% of clinical trials in the US are falling behind schedule because they can't recruit subjects fast enough. And the US Department of Health and Human Services has estimated that this is costing the US industry $8.6 billion every single year. This is the #1 issue with running behavioral and clinical research studies. In the US alone, clinical trial recruitment makes up 40% of the international market, and they're spending $1.85 billion every year exactly on this problem, getting people to come into their lab. Internationally, this is a $4.5 billion market. The XPerii platform completely handles this problem, not only for pharmaceutical and medical device companies that are running clinical trials, but also for academic research labs that are running behavioral research, and also focus groups and product testing studies being run by consumer companies like Coca-Cola. We go beyond just subject recruitment. We also handle complete management, so scheduling, payment, follow-up data collection, and essentially allows all the research to be done a lot faster, get more of it out with more significant results. So we mentioned we go beyond the #1 problem of subject recruitment. We also handle scheduling, no more use of Excel sheets. Today, payment's actually done with petty cash and checks, so you have to have thousands of dollars in your insecure lab. We take care of that for you. You pay your participants right through our platform with PayPal integration. We also allow you to attach detailed screening surveys to weed out even more people if you want to get really fine-tuned, like, do you own a Lexus? And then even for follow-up data collection, because this platform is integrated with a mobile app, say you're running a drug test, you can then send notifications to your subjects and say, hey, did you take your medication? And then right after they take it, you can ask, did you take it with water, milk, food? How did it taste? Are you having any symptoms, follow-up effects? This entire platform has been estimated that it could save the US industry $9.9 billion for pharmaceuticals alone, and these clinical trials are growing with an 11% annual market growth rate. Now, of course, this is really important that we recruit subjects very quickly. We're doing great things with targeted ads, but we're really proud of our partnerships where we donate 25% of our profits from referred patients back to these rare condition organizations. We charge for recruitment on a per-subject basis. If you don't recruit anyone, you don't pay anything, and this changes with how rare the subject is. So, 18 to 24-year-old male is pretty cheap versus depression or cancer is going to cost you a lot more. Follow-up data collection, that's a separate thing. It's very modular. You can completely customize it to your own study. The way this is done today, 86% of life science companies use print ads, radio ads, and call centers that have been shown to be ineffective. So most of our competition comes from these lower left-hand quadrants, which are just traditional marketing firms. Some companies are beginning to do this more database kind of marketplace approach, but none of them go beyond this simple connection. It's entirely up to the subject to reach out to the researcher. Nothing else on management is done by them. To date, we've partnered with Founder.org. We've received over $80,000 in investments. We're currently talking to CVS Health for a partnership, and we'll be participating in a health technology accelerator this summer in Boulder, Colorado. We have over 500 users on the platform today. We only launched this mid-January just as a landing page, and nearly 50 customers ready to list their studies. Now, to launch this, we obviously have to have a great team. Myself, I became MIT's youngest neuroscience PhD student when I joined at the age of 16. I started college when I was 11. I've been in this research field for 8 years. My co-founder, Cynthia Chen, actually just submitted her form to take leave of absence from Brown University to do this full time. She's an amazing tech innovator. We're also joined by an advisory board, specifically Michael Baum. He's sold 5 companies, IPO'd Splunk most recently, earning his stockholders $10 billion. And Josh Cohen is the founder of Amylyx, which is a pharmaceutical company. We've been working very closely with him to develop our product. And what we're doing is making research faster and more effective so that more discoveries can be discovered today. Thank you very much.
I think you've really found a market that can use better information, and there's a lot of inefficiencies, and good job finding what you might be able to turn it into for an opportunity. How are you going to get the right people? I mean, you're looking for people with specific diseases and specific problems, and it's a really difficult matchmaking challenge, and you got to get the word out to them that in a way that doesn't overwhelm them about here's the 5,000 clinical trials going on this month, but here's the 2 that you might want to look into. How do you do that?
So that's the magic of our platform. So certainly for the really rare conditions, again, we're partnering with organizations like Autism Speaks, American Cancer Society, and then donating our profits from the referred candidates back to them. So we love giving back to the community in that way. But in order for making it really simple, as you've said, when you make an account on our website, not only can you search for clinical trials and all kinds of research really easily, but when you make an account and update your personal medical information, we can automatically notify you when studies that you're interested in and qualify for are listed.
But how do I find your website to make my account?
Absolutely. So we've been doing targeted ads. That's been really working really well, even without actually having our product launched, just having a landing page. We've had over 50% conversion from people who visit from those ads, and our conversion rate cost is only $7 per customer. And we can make contracts with researchers selling these recruitments for hundreds of dollars each. Also referrals, which have worked very well for Uber, is something that we're doing. So you refer a friend, when they do a study, you get $10, they get $10. So that's how we plan to scale this as we expand nationally and internationally.
How do you relate to the CROs?
So CROs are actually our customers. One of their biggest problems is finding patients, and that's why you have to have so many different trial sites, oftentimes internationally, if you're recruiting hundreds or thousands of subjects. So they're actually our customers, but in the long term, they're a potential exit to just acquire us.
So I'm sorry, it's not clear to me what type of company this is.
Sure.
On one hand, it strikes me as a marketing agency where you're trying to have the lowest cost of customer acquisition for the researchers. On the other hand, you talk about some technology here, but I would expect to see a team that isn't versed in science. I mean, that's a great credentials to understand the problem, but I'd expect to see some awesome marketers.
Yeah, so our head of business development in the back here is Dan Williams. He's actually just graduating from Boston College with his degree in management and finance. He's been handling our marketing fantastically. We also have a team of 4 developers who are working in-house developing everything with us. But this is a SaaS platform, so software as a service platform. It's a research platform. And the biggest problem we solve is in recruiting subjects, but we really help manage the entire study from a completely automated and easily scalable software solution.
So so I understand that you're much more clinical trials management on the administration side, and you're acquiring users. Why not integrate with the drug marketers? I mean, when you see someone get a script, that's a much better indication than someone self-reporting or.
Yeah, so we're currently talking with CVS Health for a partnership.
Yeah, that's one of the ones I was thinking of.
Yeah.
But there are several others.
Oh, absolutely. Yeah. No, we just started this in October of last year, so we're moving as fast as we can.
Okay,
But I appreciate it. Thank you very much. Yeah.
How does the cost to the researchers compare to the current methods?
So far, again, we've been doing this in an unscalable way for researchers. We essentially just look for the ads that they're posting for subjects. I call them up as a fellow researcher and say, what are you guys doing for recruitment? How's it going? The answer is always abysmally. Please tell me you have a solution. And so far, 100% of them have signed up just from these really simple interviews. As we scale, because we've seen that this face-to-face works really well, we're looking to participate in conferences as a supplier, at international conferences for pharmaceuticals and behavioral research studies, and then also being published in these journals that are relevant to our customers.
Can you get to the researchers institutionally, or is all one-off?
Oh, absolutely. So a big thing is obviously colleague referrals, but we can go, I've been talking to MIT, for example, they're really interested in the payment platform right through PayPal, so it's very easy to go right to the institutions as well. Great, thank you so much for all your time.